So as facial plastic surgeons who are focused on surgery and used to seeing facelift-like results, I think we bring a little bit more critical eye when we look at these things. And while some other physicians might be satisfied with subtle changes, we really, if somebody says facelift-like results, we expect to see something in that category, at least close to it, really see a substantial difference. And what we found out over time is that many devices will come out with big claims and even good studies, excellent studies sometimes, but as we get in the hands of facial plastic surgeons who have a little bit more critical eye, we realize, well, these devices aren't quite as good as we thought they were. They still can produce results, sometimes fairly subtle, but results patients often will appreciate. But from a surgeon's eye, it's just not quite what we would hope for, certainly with a facelift. Now, we know that when we look at our statistics, that patients are coming in more and more wanting something non-surgical. They're very shy or not ready to have surgery, variety of things. And so it's important when you talk to them about these non-surgical things, and we keep seeing them every month, something new, that you do set expectations and say, well, yes, this is a device where you don't have the downtime, you don't have the discomfort, typically much lower risk, but along with that, you're going to see a lot more subtle results. And for some patients, that's going to be okay. And then why do different people respond differently? I think is a great question. I think it's partly due to, as we understand devices more, we realize that certain facial features are going to respond better to skin tightening than others. And so some patients who maybe have a fair amount of adipose tissue with these devices will see more contraction and get a nicer result. Whereas somebody who has skin that's lost a lot of its elasticity, they don't have much adipose tissue, there's really not much for these devices to target. And so the results really get to be pretty subtle, if anything. You get some intrinsic tightening with some of these energy devices that you wouldn't get with surgery. And so, yeah, I think there's a little bit something there, but still it's, you can add in a laser or a chemical peel and get a lot of that same effect. You know, I think these devices in combination, I know some people really like that idea of combining them together. I think it adds an expense, time, effort, maybe even a little risk. That's really probably not worth it, in my opinion.